On this episode of Supervision Simplified, we are talking about how to have hard conversations. Have you had a hard conversation lately? Has anyone had one with you? Do you have a process for that? Stay tuned and we'll give you some tips.
Hello there, and welcome to Supervision Simplified. We're so excited to have you on this episode. I am Dr. Amy Parks.
And I am Valarie Harris. Welcome.
Welcome. And I don't know when you are listening to this episode or where you are in the world listening, but we are in Virginia. I am in Virginia, and it is really cold. And so I am sitting here bundling up with a blanket on my lap. And I don't know about you, Valarie. Are you cold where you are?
Absolutely. In Tennessee, same thing. I see that we both have like pullovers on, and I also have a blanket in my lap, and it just feels offensively cold.
Yes, it is really, really cold. I thought it was really funny. A friend of ours said they would not go anywhere where the temperature was less than their age from now on. So I thought that
nice.
that was, I thought that was a good rule of thumb.
Yeah.
So I appreciated that criteria. Anyway, so we are at least inside, and we feel fortunate for that. But we wanted to talk today with you about some stuff that's been coming up for us and some conversations I've had recently with colleagues about having hard conversations. And this isn't really just about our having hard conversations with the people that we supervise, because certainly those come up frequently. And we'll give lots of examples of those, but also helping those individuals that we supervise be able to have hard conversations with us. And, of course, have hard conversations with their clients, but that's really like a whole nother clinical conversation. This is about the supervisory relationship and how, when it gets prickly, how to navigate that. Because, I think we live in a world right now where it's just a lot easier to say, well, I just quit. Like, I don't want you as a supervisor anymore, and I'm just going to go find a new one. Or I'm going to quit this job and I'm going to go find a new one. I'm going to burn this bridge and I'm just done. And honestly, many of us, most of us, live in communities where, this field is relatively small. And so, you burn a bridge with me and, I'm not saying I know everyone, but I know a lot of people. And, generally we chat and we say, well, like this happened with that person and hopefully you'll have a better experience. But I do feel like it's important to think through, how can I navigate this hard conversation in an authentic, vulnerable way without just throwing in the towel?
Yes, absolutely.
Now, I'm not suggesting that if the relationship is abusive or violates your core principles or your cultural identity, that it's something that you should stay in. I'm not suggesting that at all. But I'm suggesting that if it feels uncomfortable, or if there's some degree of ick there that, is not inappropriate in some kind of way that is illegal, then I do think we have an obligation as humans, but also really as people in this profession, right? Like to figure out a way to wade through the muck. Despite the gross feeling in your stomach that you want to throw up. And despite, that feeling of like, I'd really rather not do this. I'd rather not have this conversation. I'd really rather just ignore it. I'd rather send it in an email, like that would be so much easier. But the easy way isn't always the best way.
It's rarely the best way, I find.
Right. Rarely the best way. So I thought we could start with maybe figuring out or giving our audience some examples of some conversation topics that we know have come up that we have felt gross about and have had to sort of broach, either with our own supervisors or with our supervisees in session.
Yes. I know that I heard some hard truths from my own supervisor coming up in the field, and those things were very prickly. And I was younger at the time and had not done a lot of my own personal work. And she made it very clear that not doing that would affect my ability to provide good clinical care. And at one point, even called me out and stated that I was not being a good model of care, like a good role model. That I was staying at the office way too late, coming in way too early, and called me out on several things, and it hurt. Like it did not feel good. And I remember that conversation for me sticking out because I think historically I would have just cut and run. Like I think that would have been the thing I would have done, is just been like gone into a shame spiral and then not known how to like sit in that, or automatically think this person no longer cares for me, when in reality it's the opposite. You know what I mean?
Right.
So you bring all your own authority stuff in, which I see a lot with supervisees coming into the office with myself too, and they don't realize that's what's happening. So I remember that being one of those first conversations where it felt tough for me, but it was also showed me that you can have tough conversations and really keep a good relationship, and it can actually get better. And I
Right.
think that model has helped me have hard conversations with supervisees. But if you want a specific instance, I can definitely pull one.
Yeah, absolutely. I mean, I think we should. I know that early on in my career, so I started working in schools, and schools are, like half forgiving, half not forgiving. So I think I got away with a lot of situations that I probably shouldn't have in a school environment. But when I sort of took my work out of the school environment into private practice, where there were a lot more sort of deadline. I mean, there are always deadlines in school, but I
Mhm.
don't know. There's always so much going on. You can kind of get around it. I wasn't very deadline oriented. And so I ended up losing a position that I had worked for, because I just couldn't meet the deadline. I just couldn't get it done on time. I mean, I could have, but I didn't. And, finally, the psychologist that I was working for, she's like, you know what? It takes me more time to have you than to not have you. Like, it's more work for me to have you work for me than it is for me not to have you work for me. And I'm like, okay, I get it. I get it. Like, I am not an asset to you, and I recognize that. And ever since then, I that was a very valuable lesson to me. I mean, it hurt, and
Oh
it
yeah.
was super like stingy, but it was really good feedback, because I was like, okay, well, I can't just keep skating along thinking that everything is okay. Like, what we can't let that be
Mhm.
the standard when it is not the standard,
Right.
right? And so I know that happened to me early on. I also know that for me, I have always been pretty hot-headed, and I've always been a person who, I don't know if I made this term up or if someone just called me this, but I've always been a blurter. So I always said I could never go on TV, like be like Jenna on like Hoda and Jenna, or Jenna and Friends, or
Uh-huh.
whatever it's called now. I could never be on TV because I've always been like a blurter. And I was told early on by a supervisor, you really have to think more often before you speak in professional settings. Like, if you're hanging out with your friends, you can blurt all you want. But when you're in a professional setting, you have to be really careful, because even when you say something that you don't mean, not everybody knows you don't mean it. And even when you
Yeah.
explain that you don't mean it, it still is out there in the air.
Yes. Yes.
And
Uh-huh.
so and the way, the context in which you say it may also just be, it's not even like, one of those situations where, oh, I'm just joking. No, I might not have been joking. I might have said something totally just inappropriate, not even realizing it
Yeah.
just hit somebody the wrong way. And so again, someone being willing to very kindly like correct me and call me out on that, and not fire me for
Mhm.
being stupid, was really like a big deal. I mean, and it's funny because I remember very distinctly those two people, and have enormous respect for them, for having course corrected me in that way. As
Absolutely.
painful, like even today, I can feel it in my stomach right now. Like as painful as it was, I have enormous respect for them.
No, I can relate to the blurter part. Mine was like a mentor, and I think I was a case manager, and so she was a counselor, and she was a late act. I'm pretty sure, and there was always a little bit of tension sometimes between LPCs and late acts at the
What's a LADAC?
a licensed alcohol and drug counselor.
Oh, got it, got it, got it. Okay.
So not formally educated in terms of like a degree, but educated in school hard knocks, as they might say. And
Hmm.
they do have to do a lot of hours to be able to get that license. It's not an easy thing to get, but it does limit them just to alcohol and drugs, obviously. And so I'll just own it because why not? That's how we grow. I'm pretty sure that I thought I was better than in some way because I was so proud of myself getting my degree. And I believe God knew I needed to be humbled in lots of little ways. So I did during that span of time. But this woman was so kind. She was kind enough to say, you really sometimes need to slow down and think, does this need to be said? And does it need to be
Oh,
said now? Does it need to be said by me? And is this going to be helpful or hurtful? And that was in a treatment team setting because we would have treatment teams and I would just blurt out things, enjoying the group dynamic and the psychiatrist there. And no one else seemed to be put off by it, but she had, like she respected me enough to pull me aside and give me that. And I've never forgotten it since then, ever. And I think that one of our core values in my practice is intentionality. And I think intentionality for me started in that place because that was the moment I was like, oh, that's what I need to be doing. Because people would say, use your inside voice. And I'm like, I don't even know what that means. Like it's just there and I just pull it out or else I forget it. So when somebody gave me an actual framework or context for deciding what to say and when to say it, it felt so empowering. And then I had an actual supervisor who said to me, she said, you have so much power. Like you have such a big vision and you can see power dynamics really well in family systems. Like you're really good at that. And you're really good at just being open. And not everyone that you're open with knows what to do with what you're giving them. Like,
mm, hmm,
it's
hmm.
not even that you're doing anything wrong, but you got to keep that close because not everyone has your best interest. And you have to learn how to figure out who needs that information and who earns it and who doesn't. And then she always told me, just because you can does not mean you should.
Right,
And that was
right,
also very pivotal for me.
right. So when supervisees have to come or want to or need to come to us with difficult situations. So like I remember being really like aggravated with my, and actually I never really even confronted her. I just held in my pissed offness and really should have said something because it just made me, it felt very unprofessional to me. But a person that I worked with years ago was always late, always late. And in my family, early is late. So like I just don't tolerate late very well. And so especially when it comes to getting to client sessions and being able to, hold myself to a schedule. Like, I and it's funny too when you come from a school, like everything starts at, 10:22. So we need
Mm.
everyone wears a watch and you're always on time for everything. But anyway, regardless, this person was always late and really to the point of like 20 minutes, 40 minutes. I mean, we're not talking like 3 minutes. And so it was really felt very disrespectful. And I wish I had had the guts to say something back then, like, and I think I would have wanted to say, I'd like to have a conversation about valuing our mutual time. Um, and I definitely felt like I could not do that. And I wonder if anyone's had, and I wonder if anyone's had a conversation like that with you. I'm trying to think, if anyone has had that kind of a conversation with me. I mean, a couple people I think have said, I don't, I'm wondering what made you, what how you made this decision, and
Mhm.
I would like to respectfully disagree with it. And I love that. I love those conversations. Come with to me with those all day long. And
Yeah.
I've often changed my tune on those kinds of things when we have those conversations, because I'm just making decisions based on what I know and what I think is best at the time.
Yeah, sure. I guess I can say I had a semi hard conversation the other day. I know that with the supervisee, and my assistant clinical director was with me. And one of the things that she said after the fact was, she was like, wow, you've really grown over the years. And she brought up an instance of where she was going to be going to some conference and needed to miss the conference because it was very near and dear to something personal happening. And I was like, I don't get it. Like, I don't see how the two are connected. Like, that's how disconnected I was from myself, my process. And I won't go into the details because it's her stuff. But it was nice for her to reflect back to me that she had seen the growth, and she brought that up in that meeting with the supervisee, because she was like, this isn't normally how Valarie was. This isn't how Valarie was years ago. And so what it was with the supervisee is she was just wanting to schedule the amount of clients that she's supposed to have. But then I was like, I don't see a lunch break there. I don't see, I don't see your admin hours. And she has a great show rate. So, was creating that clarity around the idea is that if you're hitting the target for the show rate, eventually you don't have to book out as many sessions because you do have a good flow and a good rhythm. However, I refuse to sacrifice your capacity this early in the game, or even stretch it. Like, we're just not going to do it. We're not going to do that. So it was a little bit of back and forth around, just because she kept digging in with it with the rest of the team. So I knew it wasn't about that. I was like, there's something else under this. And it had a lot to do with time of day and feeling like, I'm better at this time of day than I am at this time of day. And so really working through some of the both and, because we know what the clients need, and the clients are going to need certain times, certain days. And although that works better for you, we have to figure out how to increase your capacity over time. And we're here to support you to do that.
Mm-hmm.
And so I feel like a year or two ago, I would have probably just given in. And I think that I've learned not to do that. And in the past,
Mm-hmm.
that's exactly what happened. I trusted that clinicians would know when they were at their capacity, and I would give them some signs like, here's some things I noticed. Let me know when this happens for you. And then next thing I knew, people were burned out, and they didn't have any of the same signs that I had. They were very
Right.
different. And so um, that was a hard conversation, because I knew for this supervisee, their heart was in the right place. They were trying to do the right thing. And so it was this, but I knew I could see ahead of what they couldn't see.
Yeah.
And I was grateful that they trusted that. And they were like, that's very helpful to hear more about the context and the why. And it coming from me made the difference. Um, but so that wasn't a super hard conversation, but it was a harder conversation. And I was able to see my own growth in that.
Yeah, and I think it is a hard conversation in that your supervisee has to be willing to trust that part of what your role is as a in your consultation capacity, you're teaching, you're consulting, you're collaborating, but in your consultation capacity, you're also you're helping to predict outcomes,
Yep.
and with the knowledge that you have and with the knowledge that they bring. And so you're sort of doing sort of you know a shared sort of magic 8 ball reading to some extent. And I know the most pushback that I get from supervisees is around whether or not to tell parents that they've called CPS,
Oh,
because I have yet to meet a supervisee who feels like gung ho about telling the parent about CPS.
mhm.
And I, in my experience, feel like the best thing, unless it's a very dire situation, which I actually have not encountered, except for once. Unless it's a really dire situation, I actually think it's valuable to be able to
Mhm.
coordinate with the parents in the scenario, because I believe, and I know lots of people have different opinions about this and it can go very sideways, but I believe that Child Protective Services is there to support families, not to ruin them.
Right.
And so I think that we can get scared of service delivery from Child Protective Services, and then we can think that they're there to just make things horrible for us. And so I don't want people to go into it scared or not knowledgeable. So I make a point of knowing the names of all the CPS workers in our city and in our area. I know all of them by name. They've met me, they've seen my face, I've seen their face. So when we call them, I know who they are, they know who I am. So I say, this person whose name it is going to be the person that's going to be calling you. They're the person that's going to be talking to you. Like, I just try to make it as really friendly as possible so that they can understand, like, they're here to help you figure
Yeah.
out what's happening. But a lot of supervisees don't want to be, no, they feel like it's going to ruin their relationship with their client. And I get that. I totally, totally do. And what I've seen happen for the people that don't appreciate my perspective on it and then don't tell the parent, it actually does in fact ruin their relationship with the
Right.
child.
Yeah.
And
Real.
so, because then the parent doesn't trust them anymore and just pulls the kid. And
Hmm.
so it's interesting. That's a hard conversation I've had kind of a couple times. And I try to give my side of it and I try to give my experience. And then at the end of the day, just like I do, they have to make their own decision and they make whatever decision they think is best. And then they see what happens. But, and I've had people strongly, like vehemently disagree with me, and that's okay. I am up for any kind of healthy discussion around things like that. But it's hard, and I appreciate it. I appreciate someone being comfortable enough to challenge, to challenge things and to challenge strategies for approaching different scenarios. I think that that's
Hmm.
really, really helpful. I think it's good to be able to do that. And so when you are looking for a supervisor, you want to be looking for someone who you feel comfortable enough to be able to ask the hard questions
Yes.
and to be able to have those kinds of hard conversations. And what do you think are some of the things that help build that kind of relationship from the very beginning?
I mean, I'm always a big fan of just informed consent in general, and just being able to um, plan ahead. You know what I mean? Like you said, predict ahead of time. So, hey, let me know when you're attracted to your first client because it's not a matter of if, but when. So that
Mm-hmm.
when that happens, it's not this surprise and it's not this like pit of shame somewhere. It's, oh, well, we predicted that was going to happen. And she's already told me all I have to do is just tell her. Or,
Mm-hmm.
here are the big three things like don't abuse your client, don't abandon them, and don't have sex with them. Like we could probably figure out almost anything else.
Mm-hmm.
Um,
Mm-hmm.
but it's better to let me know sooner rather than later. Like,
Mm-hmm.
prizes are not usually the best way to let me know something. So, um, I think it's really the whole just preparing them from stage to stage and equipping them.
Right. Yeah. I think from the beginning, really making it clear, like, here's how we're going to go about things, and starting to really like set this tone for how you're going to build your relationship. I think that a lot of times people approach me and they say, what's your curriculum for supervision? And I say, well, I don't have a curriculum for supervision per se, but one of the things I make a point of doing is spending a lot of time in the very beginning really understanding who my supervisee is, helping them really understand who I am, and also getting to know what it is that what they want on the on the other side of this,
Yeah.
who they want to be during this experience, and who they want to be after this experience. Because it's such a pivotal part of your process, but it's also not the end of your process.
Yeah.
So, and I think that that's a big, we always talk about this, but I think it's such a big part of the learning. I see so many people thinking, okay, now I'm done. And I had a fully licensed clinician ask me today, what's the policy for calling CPS on a past abuse situation? And I'm like, girl, like, you're fully licensed. Can I have to find that for you? Like, come on.
Right.
So, but it happens. We all continue to, like navigate all the systems and try to figure them out. So,
Yeah.
you were talking earlier too about a hard conversation that you thankfully were able to avoid with one of your interns around a system issue that they may not have been able to avoid
Um,
with the
oh,
class.
yes, yes,
Yeah,
yes. An
we had the same problem. And
yes, an incoming intern, who's an MFT, and we had someone who was also an MFT from the same school just the semester before, and then suddenly they now want a list of any MFTs that I've ever supervised. They don't care how many supervision hours I have, in terms of CEs. And they want me to take this course. It's a 6-hour course. And this poor student was like, I'll pay for it. And I'm like, don't worry about it. I'll just take it. Um, and it's all it is it's a document of like 100 pages with like 10 questions. And I'm like, you got to be kidding me. Like, this makes you, and there's nothing yet that says it's MFT specific. So I'm going, I mean, I would have thought my bachelor's in social work would have helped them understand, like, I've got the systems piece down, like what is the concern? But no, they still wanted a list of every person I'd ever supervised, the months, years that was an MFT. And
I couldn't even pull that out.
if she didn't have it done, then they were going to drop her classes.
And I don't think that that's just a university thing, because we had the same scenario happen. This is an online university. This client intern goes to, but we had the same thing happen. So I think it's MFT credentialing.
It is the credentialing.
Deal.
It is the MFT credentialing, but at the
Mhm.
same time, like, you are really limiting your students,
Yeah.
because
Yeah.
she had even stated there's no one within a X mile radius that will take an MFT. And I'm like, work with us,
And imagine the conversation to have with that intern when you have to say, we can no longer keep you, or, alternatively, imagine having an intern or a resident and having to have the conversation where you say, you have violated a policy, you have violated HIPAA, you
Oh, we had to
have
do that.
you're no longer a fit in our practice.
You're not allowed back in the building,
Yeah.
period.
Yeah.
Like, not allowed in the building.
How does that go?
Woo! Well, I had to have reinforcement with me so I wouldn't cave, when this person got very upset because I knew they were having a challenging time in life. And yet, it was to the point where there were being like threats were being made about calling the board and stuff like that. But it was about things like someone license should be on site at all times. And I'm like, one, that was not in the program materials. Two, you're like 6 months in at this point. You're just now saying this, like, that should have been your responsibility to know that. And I don't think that was the case at all, because we'd had other people from that school. I just believe this person was not a good fit for our practice in general, was not a good fit for our team. I think the team didn't trust this individual. The individual didn't trust the team. And there was just this constant rub. And I think we didn't have any complaints clinically about this person. So I did allow them to continue to do clinical care and supervision. They had like 8 weeks left. They just had to do it, I think, via telehealth and record sessions. I think that's how I handled that. But they were not allowed back in the building.
Yeah, we've had a situation where we had a clinician who had some kind of really strong reaction to working with me, but was not able to share that with me directly.
Mm-hmm.
And continued their work, but only shared their frustrations and their dissatisfaction with me with their supervisor, who shared it with me.
I've had that
And
before. Yeah.
and I was really disappointed, and I was like, well, I'm not willing to hire someone who can't be honest in a conversation, and who
Right.
can't, who obviously, number one, obviously doesn't even want to be here, but number two, can't have a conversation with anyone on the team. If you can't have a conversation with the people that you work with or your boss, how can you have a hard conversation with somebody's parent or someone, an attorney that you disagree with, or
Absolutely.
a pediatrician or a psychiatrist or an anybody, so I don't know. So I think that hard conversations are, it's funny because I actually think that should be a course,
Yeah.
really more now than ever before, because
Radical candor.
the
Yes.
people I see that I work with and teach and train are very like conflict averse.
Hmm.
You would much rather just sort of like let it just work itself out. I don't think that that's always the best way to do things.
No, I had a team like that in the past, and it was definitely had a lot of people on the team that were that way, and they definitely said the things they wanted to say. They just never said them to the people they needed to be said to, or at the right time. So it was very very unhealthy. Now I do believe our team is different in that way. But again, we don't accept all interns. And in the past, I did. I just would see potential and go, we'll work it out. I love
Right.
teaching, I love students, and not realizing the havoc that that can create for the entire team.
Right.
And now we've gotten very clear about who we will and won't accept. And so we turn a lot of people away,
Mhm.
sadly. And it's just because we can't risk that. We know that, working with our client population with veterans and people with trauma, radical candor is our standard of communication. So you have to care personally and challenge directly. And if you're not comfortable doing that, you have to be willing to be coached to do that.
Yeah. Yeah, absolutely. Yeah. I like the book Radical Candor. I also don't think it goes far enough in teaching um sort of the basics of having honest conversations. I think it's too in the weeds. I don't think it's easy enough for people to digest. Like I
Um,
get the concept, but
yeah,
I'm not sure that it would be something I would recommend to like an intern or a resident if they were struggling.
I wouldn't recommend the book. We have a handout, and it's part of our case management policy, and it goes into it and actually gives examples of how that applies to clinical care
Mhm.
and what
Mhm.
the difference looks like, and that has helped them connect. But
Yeah.
otherwise, we would not give them the book or suggest that they just read that, because there's a lot of things that would not be applicable at all.
Yeah.
It's just more of that chart and understanding where they fall on that chart and the consequences of, things like ruinous empathy, where they're just going to get very resentful,
Right.
or you're continuing to allow somebody to just come into session and just talk, but they're not goal directed. And because you don't want to challenge them, you're faking that you care when you're actually in ruinous empathy, which is actually not very caring at all and is going to zap your capacity. And you're going to get really bored and not like this work.
Yeah. Yeah. That's something that you should share in the community or put out in your Elevate and Educate and Elevate group.
Yes, yes,
I think
yeah,
that that would be a really helpful download for people.
yes. I think you're right.
Have you ever shared it?
No, I don't think. I think my mastermind group has it, but I haven't shared it in the full community.
Yeah, because I think that that's really cool. I think that that would be really helpful.
It was the
Any,
only thing to get the plane to land, because I kept having the same conversation over and over about why we collect fees, why we don't say we're so sorry that we are
right,
going to have to run your card. I'm
right,
so sorry I have to do this bad thing, versus life is hard. I'm sorry
right,
that happened and we're going to run your card.
right. Yeah, exactly, exactly. Yeah, perfect. Anything else you can think about that you want to share about hard conversations?
Whew. Um,
Keep having them.
yeah, that, and I've learned to sleep on things always.
Mm, mm-hmm,
Take
mm-hmm.
space, halt. 12 steps says halt. Don't do anything when you're hungry, angry, lonely, or tired.
Right.
I definitely believe in taking space, sleeping on something, and even writing down everything you really want to say, and then sleep on it, have a snack or a nap in a juice box, and then come back and look at it again,
Yeah.
and not do it in that moment.
Or even ask ChatGPT, tell ChatGPT what you want to say, and then have it rewrite what you maybe should say. And that doesn't mean you're going to read a script, but you might.
Yes.
Um,
Oh, and another helpful thing I did. So in the beginning, as a leader, I would get feedback that I'm very different in person, like face to face conversation versus written word. So I put Grammarly for Business on my computer and had it start tracking all of my written communication. And it would send me a report at the end of every week and tell me the tone.
Mm.
And so my tone was very direct. It was very confident, matter of fact. And so people were receiving that when it was in a written form as it being like this versus being just candid or friendly or informative. So I
Got
really
it.
had to work on softening how I speak in writing, both to clinicians and clients. Because if I was stepping in between a clinician and a client to solve a problem that I didn't want to step into, but had to, and that client didn't have any knowledge of me other than my role, then they don't understand how to take what I'm saying either. So I really had to like start softening all the things written in a
Yeah,
written
that's
form,
smart.
just knowing that I can come off kind of abrasive.
I love that. Well, hopefully you've learned a little bit about having some hard conversations. And if you have hard conversations to have with people that you're supervising, or people are having to have some hard conversations with you, maybe you've learned a little bit about how to manage those, and maybe you're going to be able to handle them in a much better way. We thank you for tuning into this episode of Supervision Simplified. Remember, the revolution starts here, and we hope you'll subscribe to our podcast and that you'll share it with your friends and colleagues. We also want your comments, your stories, and your feedback so we can be sure to be talking about all the things that interest you most. Until next time, keep on having hard conversations and simplifying and elevating your supervision game.